about the golden hour, and that's the hour post-birth when you just spending time getting to know your baby in that lovely oxytocin bubble. So it's just the two of you and your baby as you welcome them into the world. Now, in that golden hour, there will be some things you need to consider, like delivery of the placenta, and we spoke about that already. And also your midwife will check to see if you've had any tears. And I've done another separate video on tears. And also they'll be checking on the health of your baby. So they use a standardised test called an AGPAR test. Now, it's quite outdated. It was devised by a woman called Virginia Abkar back in 1952, but we still use it. It's a standardised test, and it basically measures several key components, several key factors of your baby's health at 1 minute, 5 minutes and 10 minutes. And what we would expect to see is an improvement from that 1 minute to 10 minute period. Now, the scores go from 0 to 10, and what they're trying to identify are those babies that may need a little bit of additional support. So if your baby scores 7+, there's no need for any interventions. If they're somewhere in the middle, they might need some support. It could be a little bit of oxygen. And if they're in the lower end of the scale, they might need to go to special baby care or neonatal care, whatever it may be. So what they're looking for is 5 different areas. The first one is appearance. So what's their colour? What do they look like? Quite often babies are quite blue when they're first born and they pink up very quickly. What's their pulse rate? Obviously, which is what the P stands for. Grimace, so what is their reflex response? Have they got reflexes? A is activity tone, so what's the tone of muscle like? And then R stands for respiration, so are they breathing? Are they breathing well on their own? So as I said, this will be done at 1, 5 and 10 minutes. You won't know it's going on, to be honest. I have been in so many rooms and had no idea when the midwife has been doing these checks. So you don't need to worry about it. It's just something your midwife will be doing whilst you're getting to know your baby. Other things that will happen in that golden hour is your midwife will also ask if you want a vitamin K injection for your baby. Now, vitamin K is something we offer all babies in the UK. You can opt for either an injection or an oral administration. With an injection, it's done there and then, straight after birth. With an oral administration, it's done over a period of 3 separate administrations. How many times can I say that word? So you will need to go back to the hospital to get those as well. So just keep that in mind, particularly if you're birthing at a hospital that's a distance away from you. Now, it is a personal choice when it comes to vitamin K, and I always encourage all of my clients to just really read up on on vitamin K, and there's a lot of information out there. There is a great midwife called Sarah Wickham who has written extensively about vitamin K. Now, the reason we offer vitamin K is as humans, we have quite low stores of vitamin K, and we know that there is a very rare disease that can impact around 1 in 11,500 babies, which is a vitamin K deficiency. The problem with it is it's very hard to identify, and often it means a baby has internal bleeding, which doesn't get picked up and sadly can be fatal. So we offer all babies a boost of vitamin K straight from birth. So it's up to you if you choose to have it or not. As I said, I do encourage you to do your own reading to make the choice that's right for you. And then also you can make that choice between either the injection or the oral administration. Now, I often get asked, what's the difference? Why would I do one over the other if I'm going to choose to have vitamin K? To be honest, there isn't. Some parents feel uncomfortable about their babies having injections so early on. And there used to be a bit of complete misinformation out there about the fact that it could be quite toxic. There is no risks to the vitamin K injection at all. But some people just prefer to do the oral administration. But as I said before, you do have to do the full course, and that may well mean that you have to go back to the hospital that you birthed your baby in to get it. So worth having a word with your midwife and just understanding what the protocol is in your local hospital. So the golden hour finishes obviously an hour after birth, but really it needs to be protected and maintained for as long as you possibly can. So certain things that can sometimes disrupt that is the midwife taking baby off to weigh them. Now, it's up to you. Of course, you might want to know how much your baby weighs very quickly, but I always encourage my clients to wait for as long as you can. And actually, a lot of the births I've supported is done quite far down the line. It's normally done way over an hour before they even consider, thinking about weighing baby. But sometimes for the midwives to do all of their paperwork, they need to have the weight as well. So they may say to you, is there any way we can just do it? Because I really need to kind of sign this all off so I can get the paperwork done. It's up to you. With the weight, always take a photo. I have come across lots of families who have been told the wrong weight. And whilst that might sound like, well, it doesn't really matter, it does make a difference when it comes to weight loss, because babies quite often will lose weight after birth. And if you've got the wrong weight written down on your notes, then that could make a big difference to whether or not you feel your baby is feeding well. So always take a photo, so you've got that weight, and you know what it is. Thanks for listening.